Recording
Namaste.
start. Geeta,
Yes, ma'am.
you can start.
Namaste, ma'am.
Namaste, Koti sir.
నమస్తే మేడం.
Namaste, sir.
నమస్తే. ఏంటి స్పెషల్ ప్రోగ్రామ్ పెట్టినట్టున్నారు?
Yes, sir.
మంచి ప్రోగ్రామ్ పెట్టినట్టున్నారు కదా, అందుకే టైం తీసుకుని మరి త్వరగా వచ్చేసాను క్లినిక్ నుంచి.
అవునా sir. Thank you.
Geeta, you can start.
Yes, ma'am. Still 2 minutes are there. Ma'am.
Recording started, no?
Then we'll start. Om Dhanvantare Namaha. Good afternoon, dear Vaidyas. Welcome to RAAAUOS group. This is our 37th webinar series actually. Nice discussion was going on before starting this session. Really our group is knowledge enhancing sessions will be there in our group. Actually we are conducting many knowledge enhancing even discussions also weekly twice. Okay, with this we'll start today's session with prayer by Dr. Manjula ma'am.
Thank you, madam. Let's start.
Before starting the prayer, I would like to request everyone to mute the gadgets. Dr. Manjula ma'am.
Yes, ma'am.
Welcome ma'am.
Ma'am, thank you. Let's start. Om Namami Dhanvantarim Adidevam Surasurairvandita Padapadmam Loke Janarupaya Mrutunasam Sataramisham Vividaushadinam Yogena Chittasta Padena Vacha Malam Sharirasya Vaichyatena Yopakarotam Pravam Dhanvantarim Pramanatam Sarvaroga Nivarakam Ayurveda Vande Piyushadayakam Sarve Janaha Sukhino Bhavantu Sarve Santu Sarve Bhadrani Pashyantu Kaschit Dukkha Om Shanti Shanti Shanti.
Thank you ma'am. Now I request our founder Dr. Shakuntala ma'am to say a few words about RAAAUOS.
Thank you, Geeta.
Welcome ma'am.
Om Shri Dhanvantare Namaha. I welcome all delegates for this wonderful 37th RAAAUOS webinar. I wholeheartedly welcome Sudeep sir for this webinar because sir is going to share his immense knowledge in the field of cancer and in tripala in different aspects. Because as all we know, very right and left hand we are using tripala, but in different aspects sir is going to tell. It's a very different today's seminar will be. And about RAAAUOS is all we know, RAAAUOS is Rudra Arbuda Ayurveda approach under one shelter. As name suggests, all the Vaidyas will be bringing to one platform to discuss about the cancer, to share their knowledge, to get the knowledge, and to connect each other. Because to connect each other is a word, like we are not connecting because of this lack of communication. That's what the main intention of the RAAAUOS team. And about the RAAAUOS, what is saying, it is conducting, as Dr. Geeta said, weekly twice we are conducting classes. One is on Monday which is led by Dr. Savitri, and one more is on Thursday on cancer, that is led by Dr. Manjula ma'am, and that is on cancer, and Monday is on especially on one yoga or some diseases actually. And in spite of this, we are conducting Rasashala monthly ones, and we are organizing educational trips, and we are conducting awareness program regarding cancer. There we are discussing about Rutucharya and Dinacharya, and we are conducting screening camps, especially oral and breast cancer. In the month of July, we have conducted in the Bangalore itself more than 20 places, and outside Bangalore, throughout Karnataka, more than 25 places we have conducted screening camp. In the 1 month, usually one screening camp will be usually going on, and research study has to be conducted because that has taken up initially, but still it is protocols we are making. Right now it is kidney cancer protocol is going on. And along with that, one more thing, we have newly started collaboration, because all the diseases starts from Nidana, that is Ahara, which is very much contaminated today, become toxic, which is Amrutatulya initially. So work on that, Ross team has already started that work. And along with that, I'm very happy to announce our first workshop on Arbuda, Agnikarma and Vidyakarma in the January 7th, that is offline at Bangalore in Matikere. And we have already shared the posters. I request all the delegates to join the workshop and get the benefit of workshop. And because our beloved Koti Nagarjun sir is coming from all the way from Hyderabad, and our experts, Dr. Shubhamangala madam, Vijay Lakshmi madam, and Dr. Likith sir is going for Arbuda and Agnikarma and Vidyakarma. Please take this opportunity to enhance your knowledge. And once again, I welcome all the delegates to this 37th our RAAAUOS webinar. Thank you, sir. Over to you.
Thank you, ma'am. Thank you once again. Now I call Dr. Savitri to introduce today's speaker. Over to you, ma'am.
Namaste. Om Shri Dhanvantari Namaha. Namaste all. I'm Dr. Savitri from Alvati Shimoga. I really feel honored to introduce our today's guest speaker, Dr. Sudeep Konkani. Dr. Sudeep Konkani completed his BMS UG in C.B. Guttal Ayurvedic Medical College, Dharwad, and PG in Kai Chikitsa in Acharya Deshabhushan Ayurvedic Medical College, Bedakinal. Presently, he is working as Assistant Professor in Department of Kai Chikitsa in Mahaganapati Ayurvedic Medical College and Hospital, Dharwad. He has also his own private clinic setup named as Devadhanvantari Ayurvedalaya in Dharwad. Sir has also presented 2 papers in national level seminars and also wrote many articles. With these few words, I would like to thank our RAAAUOS team for giving me a chance to introduce our guest speaker. Thank you one and all.
Thank you, Dr. Savitri. Now I request Dr. Sudeep sir to start the session. Over to you, sir.
Thank you, madam.
Welcome once again, sir.
Sir, please share your PPT, sir.
Yes, madam. I'm sure. PPT is visible, madam, now?
Yes, sir. Yes, sir.
Shri Gurubhyo Namaha. Good afternoon, everyone. Myself, Dr. Sudeep Konkani. I am presenting today a webinar on my clinical experience on cancer Ayurvedic management. So everyone know cancer. Cancer is an uncontrolled cell division of a cell. It's also spread from one part of the body to another part. Then how we have to understand by the way of Ayurveda. From Ayurveda, basically we have easy to understand. We have only 3 dosha. The 3 doshas are costly factor for all the things. So here the cell division is done by Vata and Pitta, and the growth is occurring in the Mamsa and Kapha, that is related to Mamsa and Meda Dhatus. When we understand Ashraya Bhava, wherever we are considering the growth, those are predominantly of Kapha dosha predominant, and cell division and formation of new cell is done by the Vata and Pitta. For that we can take a reference from Garbha, Vayu Vibhajati Tejayena Pachati. Vayu is dividing the cell, Teja making the pachan of the cell, later the growth is occurring. But in Sharira, it is going on Prakruta way. When it is disturbing, it is going to beyond the level. As per we consider it as a Vikruta, um, Vikruta Dhatu, or we can consider as Apakwa Dhatus. So overall, when we come to the Siddhanta, what can we do? First thing is we have to increase the Jataragni, as it is told. It is a major causative factor for all the diseases. Next, we have to control Vata Pitta, reduction of Vikruti of Kapha. The Kapha is going to accumulate and forming this Vikruta Dhatus that we have to reduce. After that, we have to give a Prakruta Bala to the Sharira by using our Rasayana Vajikarana. And most important is we have to make Samprapti Vigatana, because only considering that or considering the cancer, we cannot handle all the things. We have to think which disease it is forming and where it is the formation of the disease was started. So by this brief introduction, I will start with my clinical experience. Starting few cases, I don't have a reports because I lost in my old phone. End cases, I have reports and images I shown. I am audible?
Yes, sir. Yes.
Okay. It is my first case. 50-year male patient came with a report of esophageal cancer. OT was done. They don't want to go for chemotherapy. Before the starting, I want to say another few things. What happening in present day? Mostly people comes to Ayurveda after OT. They don't want to go for chemotherapy, and they want to stop the spreading to the other organs. Very rarely, or when the allopathy people say, okay, we can't do anything. It is only how much time it will drag, that much time we can handle. In only such a patient, we will get more. Nowadays, it is trend of changing. Directly, patients are coming. That's we feel we are lucky. But in initial days, before 5-6 years back, it was not such a trend. The first case was 50-year male esophageal cancer. What was done? They don't want to go for the chemotherapy and also improve their lifespan. When I seen the Lakshana, all the Lakshanas are matching with Aruchi as per the Shushruta Uttara Tantra. So I diagnosed that as Aruchi and I started my treatment. Patient was survived up to 8 years. In the last 2000 January, the patient was lost. What are the Nidanas I seen in that patient was smoking and alcohol consumption, and the person belongs to baking industry. They have to prepare regular sweets. They have to taste and other things they are consuming. That is irrespective of food was there. Predominantly they are using alcohol and cigarette smoking was lot, and lot of stress was there to the patient. When the patient came to my clinic, even they are not able to enter to the clinics. They drop the car. I have to provide a chair in front of the car only. I seen that much bala was lost. I after taking history, I started with a Dadi Madi Churana with Swarana Basma, Ashwagandha Leha, Patola Adi Kashaya, and after 1 month, I given Madhutailika Basti. I will justify as Dadi Madi Churana was directly indicated in Aruchi Chikitsa. One thing I always use Swarana and Tramra for cancerous patient. Swarana for maintenance of the health of cells, and it has the capacity to regenerate. And Tamra we are using to make the crushing of the cells. As it was there, along with Dadima Churana, I used Swarana Basma. To increase the bala, I used Ashwagandha Leha. Patola Adi Kashaya, usually I used after going for OT. The structure was damaged. The pitta which was there has to present in the amasha, that is coming, regurgitation was occurring. So that regularly they have to consume a pantoprazole they given. So stop that. I thought Patola Adi Kashaya. Position of the sleep already they instructed. I told maintain that position, and Patoladi Kashaya was continuously given. After 1.5 months, I given Madhutailika Basti to increase the bala again. So patient got complete strength and they started walking. Routine was there. After that, regularly they have to come for a visitation. I changed the Rasayana. Initially, I given 3-4 months Ashwagandhadi Leha. After that, Ashwagandhadi Rasayana I given. Brahma Rasayana I used. Whenever they feel cough and cold, that time I have to give Agastya Hritika Rasayana. So like that, we are balancing the strength. Whenever they feel energy was losing, they have to come. They will take the Rasayana for 1 month, 2 months. They will leave. Like that, the patient was continuous in touch. After COVID, they lost drastic changes was occurred in their business. Again, they started consumption of lot of alcohol and regular smoking was started. So the one tumor was found on chest wall that was converted into metastasis. It was opened up. That time, patient is not willing to take any medicine. It was occurred at the 2022 May. So initially they don't want to medicine. Say they were tired of. I don't want to leave. The feeling was like that. So we left the patient again. After 1 month, they want to, okay, we'll go for some medicine. We given some again Rasayana form. Only I given Brahma Rasayana I given, and that time I given one Vishahara Yoga. I consider whatever they are consuming, alcohol and smoking, that is acting on the Visha, the Astanga Hridaya, Vishadikarana, the Swarna Makshikadi Yoga was told. That yoga I given to the patient. Again, the life was extended up to January. We lost the patient. Total, it was eight years, and it was my first patient of cancer. So I tried with the many changes, but what I'm saying, this was the main prescription which I given. After that, whatever symptomatic I am getting, for that I'm treated. Many time I go for the Nitya Virechana in the form of Patola Katukaro and Adi whenever I feeling Pitta was increasing, or whenever Bala is decreasing due to any other diseases, Jwara, normally Kasa and all, related to that disease, as I'm using Rasayana. 2 times I used Brahatvada Chintamani. They felt total loss of strength for the body. They feeling almost the hand is not functioning. Like that condition was there. That time I used Brahatvat Sintamani. At the end, I used Vishahara Yoga, which I told Swarnamakshi Kadi Yoga. Shall I continue?
Yes, sir.
Okay. This is a second patient, 25-year male patient come with a report of testicular CA. After that, they told they will go for the OT, and we don't. Again, their statement was same. They don't want to go for chemotherapy. As the patient came, I took a history. There was no any symptoms. They unfortunately, while bathing, they seen the tumor, small growth over the testis. They went for the different investigations. They told it as CA. Age was normal. Even Agni was normal. Bala was normal. They went for the OT. After that, they again come for to avoid a chemotherapy and increase the strength. I thought there is no symptoms. So I thought, what should I diagnose? Diagnosing itself was a question. So initially it was Arbuda was there. Some growth was there. I thought, okay, after OT, some Abhigata was take place to that place. By considering that, I given Vajikarana Chikitsa for 3 months. Patient was still today healthy. There is no any symptoms or repeated symptoms are seen. Ashwagandha Churna with Swarna Basma, Kapikacha Churna and Ashwagandha Rukrita given. Only 3-month treatment they took. Till today he was happy. No symptoms are occurred. Even when he came to me, that time also he was normal. Just as a preventive we did, considering the Abhigata to the Sthana. Third patient was 60-year female patient, comes with a report of lung cancer. In allopathy, they left the case. Okay, the patient is going to die in 1 or 2 months. We can't do anything. When they came to me, I consider it as a condition of Shwasa because there is a lot of difficulty breathing and complete Bala was lost. I given Nitya Virechana with a Haritaki. Rasayana I tried in this patient was Agastya Haritaki Rasayana. As a Shwasara Chikitsa, Shringyadi Churana with Swarnavasma I given. After that, the patient went for chest X-ray. They felt that accumulation of fluid in the lungs. So I thought to use Punarnavadi Kashaya. The same thing was repeated regularly. After Agastya Haritaki Rasayana, next month I changed with a Vishishta Rasayana. Alternately, I used Agastya Haritaki Rasayana and Vishishta Rasayana. Patient was life was extended up to 6 months. Up to death, they are healthy. There is no any complication has occurred. On normal life they did, suddenly they collapsed. Only one complication is occurred, that is accumulation of fluid. They went for allopathy investigations again. That time they noticed some fluid accumulation was there. In this patient, in between once I used cytochromyl tablet of Ayukalpa pharmacy for 30 days. Another patient, exactly I told no, I lost some report and details of the patient. Age and other things I don't know. Exactly not remember. The patient come with a pancreatic CA, again the same thing. allopathy patients says no, we will not conduct anything. It is not possible. How much they live, that much. When patient comes to me, even the complete Agni was Mandya, patient was not able to consume any food. Even they are not feeling any taste for the food. Complete stoppage of food was occurred. I diagnosed it as the Aruchi and Schuler because little pain was there at the Pashwa Pradesh. Treatment given is Tadi Madirasa with Vidanga. The reference is from Vaishya Ratnavali. To just, I told, make a gargling and after that, swallow it. Chincha Panaka was given. Katuki. For this patient, I used Katuki as a Shodhanartha. Even I thought the complete Bala was lost. I felt there is a lot of Mala accumulation in the coaster. To remove that, Katuki was used. Swarana Vasanta Malini, I used, as I told, the patient was completely lost his son. As a Dhatu Vardhana, I used Swarana Vasanta Malini. Again, the patient was only survived up to 6 months. And they also don't want to consume a lot of medicines. I told I plan to give some other Rasaushadis here, but the patient is not willing. So they told, okay, this much. They wanted to little happiness, little strength to walk in a home. That's what they wanted from my side. The fifth case is rectal CA. The patient is again, they told allopathy patient, the patient will collapse in 1 month. We will go for, we can't do anything. So severe hiccup was there at the evening. Patient was not able to sleep. For that reason, they came to me. They wanted only stop the hiccup so patient can sleep at the night. When I took a history of that, the patient is working in a bakery. The regularly, every day, they has to consume a pups, which is made up of maida and all. After that, whatever the preparations going on in a bakery, they have to eat and consume. I consider all our Abhishandi, Soto, Avrodakara Ahara was there, and Grahani Samprapti was occurred. Muhurbadha Muhurmala Pravruti was there when patient comes to me, and severe hiccup was there at the evening. Patient was not able to speak. By considering Asadhya Grahani, evening Eranda Tela Basti was given just to make Vatanulomana, so hiccup has to stop. It was stopped, patient was started sleeping. Hemagarbha Potal Rasa was given by considering to protect the prana as a hiccup was there. In Sharangadar Samhita, it is told it protect the prana. So I used Hemagarbha Potal Rasa. Bilwadi Siddha Peya, which is explained in Vangasena. It is explained as Asadhya Grahani Hara. That yoga I given for 1 month, patient was produced that, but after 3 months, patient was collapsed. Hiccup was stopped for 1.5 months. After that, they again come. Again, I given a 6 bastis. The patient is also wanted only that much. They wanted to sleep healthily at the night. So I also not tried any much more thing, but little improvement was there. Patient was not willing to take any medicines. This was of my present case. I have all the images and photos. Patient comes the oral CA. My diagnosis was Mukha Vidradi. When I took a history, the patient is working in a mill, a paper mill. It is from Dandeli. They has to expose for the regular dust and chemicals. By that, that was the only Nidana. Another one Nidana which I got is before 15 years, they has to consume some tobaccos. By considering Vidradi from Mukhasthana, Varunadi Kashaya I given. Shilajitu with Tamrabasma, Gandakadi Yoga is there in Vaishya Ratnavali, Gandaka, Haritaki, Gruta, and Madhu was the combination which I given. Again, here, what I did is, whatever Varunadi Kashaya we are giving internally, I'm not told to swallow it regularly. Hold it in the mouth, slowly swallow, and Shilajitu Tamrabasma, which is given, that is also told to apply over the growth and it will dissolve itself. Gandhakadi Yoga is also given same. 3 times I given. As I told, increase the Agni. For all the patient, I used Mustajala as a continuous pana. I have to advise 1 liter of water, add 1 or 2 spoon of Musta, boil it and drink whenever you feel a thirst. You have to drink that water only. And this patient, especially I advise to keep only on a light head as a Shastika Shalian Grita, Shalian Shira, or only Kshira. That was the only option given for the patient to consume a food. There is no food was advised. These are the reports of patient oral they diagnosed as a oral carcinoma. This is the growth when before starting the treatment. This is a growth after growth was lost. Complete edges are remaining after 25 days of treatment. It was a miracle happened even I am not accepted this much of changes are going to occur. In this patient regularly another thing was done as tripala kashaya, kandusha 5 times a day. That was given after second month that the edges are gone up. The only one thing was remaining, that was a severe pain into the oral region. So I told in Triphala Kashaya, I had a Grita and Gandusha Pana. So that was gone up. Patient was not willing to do any other investigation. They said, okay, we are happy. The food is following. Strength of okay, sir. We don't want to continue the treatment. The patient are financially lot of poor. So in the second month, I used Tamrabasma with Swarna. Initial days I told I used Tamrabasma with Shilajitu. In second month treatment, I used Tamrabasma with Swarna. So other growth which is left in this image, that is also gone up. But patient told we don't want to go for any other further investigations. Shall I continue?
Yes, sir. Yes, sir.
Okay, this is the another case. Breast cancer. They came with a diagnosis of breast cancer. Here the different parts are didn't have any patient because lot of 52 years female patient. She was somewhat mentally retarded. When I started taking this history, she was not saying anything. Her relatives were saying, when I goes on asking, they didn't got any proper nidana. What the patients are saying, she is regularly working and consuming the normal home food. Only sometimes she has to consume what we'll call papude. We'll call a papude in our Dharwad. It is just preparation from rice, just like a
Sir,
papad.
sorry to interrupt you. Sir, Sudeep sir, sorry to interrupt you. Your voice is not clear, sir. Little disturbance is there.
Okay, madam. Shall I change the place?
Previously it was okay.
Now it is okay, madam.
Yes, sir. Yes.
Okay. This is a case of breast CA. They brought a report. The patient of mentally not. It is little disturbed. They say from beginning only like that. They are not talking properly. They don't know anything. The lady is acting like a child. Even they don't know anything about the history and all. The patient relatives, when I asked, they say nothing was wrong. All the things are healthy. Previously, there is no diseases was occurred. Chronic disease was happened. This was the first time happened. Even that was noticed by chance. While wearing the dress, someone noticed it in the home, some growth was there on the breast. So they went for the history. Except eating of papad from the marketplace, no other nidana I noticed. So I consider it. Another thing was patient was not saying anything. Any pain, fever, nothing was there. I diagnosed it as Tanakilaka. Again, I told Mustadala was my regular choice. Shilajitu I given for consumption and application by considering Kapha Medohara property and Rasayana. Shigradi Lepa, which is there in the Baishaja Ratnavali. Shigru, Ishtika, Churna, Gomaya. Another one ingredient was there. That's I given. Again, Haritaki I given for a Nitya Shodhanartha. Varunadi Kashaya I given. For Abhyantara Shodhana, it acts as Kapha Medohara and Abhyantara Vidradihara Kashaya. Again, I want to say another thing. Varunadi Kashaya we can use with the Rasa Sindura, that is explained in Rasa Tarangini. But in second month, I used Varunadi Kashaya with Rasa Sindura, but initially I started with the Varunadi Kashaya. These are the reports of the patient. This was the growth. The growth size was on the pencil. After 2 months, the patient feeling, okay, growth was reduced to little size was reduced. Patient was asymptomatic. Simply, I took a tumor marker to consider. The tumor markers are normal, but still growth was there. Still treatment was continued. Patient was completely healthy. No symptom, any symptoms are occurred. Only one time after application of Shilajitu, they got a little pain. That is also the dragging pain which occurs after application of Shilajitu or Vacha Churna. The treatment was going on. The case, this patient came with the ambulatory adenocarcinoma. Again, the patient came with after the OT. They want to avoid chemotherapy. As the Lakshana, the person is belongs to from Brahmin family. They have a habit of eating continuous food, different variety of food, and lot of consumption of dadi was there, and banana was there. Regular usage of banana was there, and the adhyasana, lot of adhyasana was there. And another thing was patient was staying alone. Whatever he make, he eat all the things irrespective of considering the Agni. That was the major nidana I got. By considering all those nidana and lakshana, I consider as pitta jagrani. Patoladi kashaya is given for the pitta harana. Mustadala again given for Deepana Pachana and increase the Bugil. Shirabala Taila Nitya Abhyanga was given. Brahma Rasayana is given for the Shodhana and Rasayana. Brahma Rasayana, which is explained in Charaka Samhita, that act as both Rasayana Chikitsa and Rasayana and Shodhana action of there. Again, this was the first month where I feel there is no Agni. Again, in the second month, along with Ashwagandha Churna, I given Swarana Bhasma in this patient. These are the reports from last 6 months. Last September, the treatment was going on. Patient was happy. Shall I continue?
Yes, sir. Yes, sir. You have a lot of time.
Okay, madam. By these all patient I want, which last I explained. From that, I want to say that there is nothing can disturb the dosh except the dosha dushti. Nothing can happen in our sharira, which is explained in Charaka Samhita. Tasya prakruta dushto dosho sharira manasaha dehena nahi nirdosham jwara samuchiti. In jwara adhikarana of jwara Charaka Chikitsa sthana, Acharya says clearly there is no other things except dosha is possible to form the diseases. Only when the doshas disturb or loses their prakruta avastha, then only the formation of the disease was there. Again, the formation of the disease, sarva eva nija vikaranam nanatra vata pitta kaphobyam nirvasnanti yatadi shakuni sarva divasapi parivarte swachaya nivartante. Here they wanted to explain that vata pitta kaphas are main predominantly causes. Without the Swadhatu Vaishamya, there is no lakshanas or no diseases are going to form. The Buddhiman Vaidya has to consider Vata Pitta Kapha, Sthana, Samshaya, Prakurti, Vishesha, and Bala. Based on that, we have to adapt the treatment. That's why all the patients which I took, those all considering as a different treatment, not consider as the only treatment. The importance is given to Sthana, Prakurti, Desha, and Nidanas. Chikitsa Sutra for Anukta Vyadhi. This is explained at the end of Charaka Chikitsa Yonivapathadikarana. Dosha Dusha Nidananam Viparitam Hitam Dhruvam Ukta Anukta Gadanam Sarvanam Samyak Niyachate. By considering Dosha Dusha Nidana, Viparita and Hita to the Sharira, we have to give the treatments. Anything should I explain?
Sir, your presentation is completed.
Related to cancer, this was a cases which I wanted to present, madam.
Okay.
And another thing I want to say, whatever the cancer was there, from all the patients I not mentioned in the slide, I used Mustajala as a regular pana, and Swarana Bhasma along with Tamra is used with their respective of their yogas. From Aruchi, I used the Swarana and Tamra with Dadima. In oral cancer, I used Tamra with Shilajitu. Like that, regularly I'm using Swarana and Tamra in the CA patients. And all the protocols are different, madam. I'm not using the same protocol in all the conditions. Which all the protocol I used, I mentioned.
Okay, sir.
So you can continue the tripala in different aspects, sir. And later we can take up the questions, sir.
Okay, ma'am.
Okay, sir.
From this, I want to conclude this aspect, especially as a diagnosing part. At the end, again, Charaka Acharya says, Yoge Reva Chikitsam hi Deshadhe Aparadayati Vayo Bala Shariradi Bedahi Bhavet Mataha, without considering Vaya Bala Sharira Vedan dosha, if you are treating any patient, it is considered as aparada. So I feel we have to consider all those things and put a treatment aspect. Without considering those all, if he simply goes on giving the treatment, it doesn't work. Or we consider only as a CA, okay, some special formation like a sword. How we have to use that is the art, be considering the different aspects. That's what I wanted to say in this point. Thank you.
Thank you, sir.
I will share the
Yes, sir.
if any discussion is there, discuss it. After that, I will start with the Tripura. And then I will start using around 46 combinations which I wanted to explain in Tripura with the different conditions.
You
Shall I
can
go with that?
explain, sir. In the end, I
I
can
think,
take the
Geeta,
question.
sir, let us take up questions for 15 minutes, sir. Because sir have
Yes, ma'am.
46 formulation means it will take into next different level of discussion. No? So we can,
Okay.
please you can take up the questions. Then we can go ahead with Triflad.
Okay, sir. Okay, ma'am. Thank you, sir.
Thank you.
So many patients are approached to you, cancer patients.
Yes.
I'll take the questionnaires. Sir, I'll read out for you, sir. Shall I take?
Yes, madam.
Namrata Kuralkar is asking reference of Vishahara Yoga.
Which madam? Vishara Yoga that is explained in Ashtanga Hridaya Vishachikitsa madam. Swarnamakshika, Sharkara, and Swarnabhasma was a combination. Sarva Vishahara Agada was there, madam.
If anyone wants to
One
ask the
more
questions,
time,
they
sir.
can raise.
Swarnamakshika Sharkara.
Swarnamakshika, Sharkara, and Swarnabhasma, madam.
Okay, thank you, sir.
Okay. Dr. Prachi is asking, what diet do you prescribe to your CA patients?
Madam, as I told, Jataragni was my prior important adjuvant. So all the patients Mustadala was common, or either I will go with a Mustadala or Panchakola Jala for regular usage. After that, initial days, minimum for 20 to 30 days, rice and ghee, rice and milk, or only milk was my choices. When I feel the Bala and Agni was increasing, slowly I will start increasing rice and rasam and other things. But first 1 or 2 months, only choice is rice, ghee, or rice milk, or only milk. Because I want to increase the Agni and Bala of the patient.
Okay. Thank you, sir. Dr. Harsha is asking, how you do the perfect Ayurveda Nidana, and what about metastasis?
That was the first patient I told no, madam. The 8 years they was less expanded. The patient was reported as a metastasis. It was spread to the lung, liver, and chest wall. Again, one tumor was occurred. So we are not giving more importance to the reports, as the patient says. One time I may miss the nidana and other things, but regularly I will spend a minimum half an hour to 45 minutes with each patient. They will go on. I will say simply say. I will not put any leading questions. First, I say what are the complaints you have. Say that. I'll try to notice what all the complaints are there. When they start stopping, I will ask you if you left anything or any future history of disease, future history of OT or anything like that. You consumed the medicine more than 15 days. After that, they explained again. I will ask any other symptoms you feel or any thing medical history happened in your life. When they stop saying, I will ask the daily routine from beginning of get up to the sleep. What are they are doing? Step by step, they have to explain. In that, I try to find the nidanas. Even I didn't got in that. I will ask any special thing you are doing in a routine, or any special food, or any daily food you are doing, any daily activity you are doing, any tablet medicine history tablet we are asking. In that, usually we will find sometime 1 or 2 times we will miss. If we miss, again we will take a history in a second time to find out the proper Jnana and Sampatti. Usually 50 to 80% we will get. Sometime we will not feel happy. Okay, this may be the not reason, any some other reasons are there. We'll ask the patient to remember and tell, or while coming for that time, if we feel anything important to say, bring that so we can think over it. Sometimes the patient will bring for the second time of some nidanas. And diagnosis, as you I feel, which is a predominant symptom and other associated symptom, my concentration is on that only. I will not concentrate more on the report. Concentration always given on the symptoms which they say.
Sir, in your slides, not a single time you use word arbuda.
Yes, madam. I used one time oral cancer. I think I used it.
Okay, sir.
I used Mukha Vidradi. I used it because I feeling it was going for the Paka. So I will consider it as Vidradi, Mukha Vidradi. That's what I told them. All the considering Vidradi, we are using only Swarana Tamra or Hemagarbha Tamra Garbha Potali, Kanchanara Gugulu. Only Varanadi Kashaya is not helpful. Okay, Varanadi Kashaya is helpful. I used it in repeated conditions. Swarana was definitely helping along with Tamra Basma, but the Avastha is different. The Stana, Avayava, which is damaging, that we have to consider. Without considering that, only considering Arbuda, we are giving the treatment. I don't feel happy for that. That's what I told in the last slide. Our Acharya clearly told us, consider Desha, Avastha, Dosha, then treat. Otherwise, it is considered as a aparada for ourselves. So from initial days, I considering that only.
Okay. Sir, what to do for perfect Ayurveda diagnosis, even along with Samhita reading? How to take applied part from Samhita?
From that, one best quotation was there in Ashtanga Hridaya Sutra Sthana, Abhyasat Prapyate Drishti Karma Siddhi Prakashini, Ratnadi Sarasau Jnanam Na Shastra Deva Jayante. Regular study of Shastra and along with that clinical exposure. Whatever we are seeing in the clinical, which we have to again correlate with the patient. How I developed myself from the initial days, I started my practice from the final year UGA. Initial days, what I have to do, I have to ask the patient everything. Whatever the things they are saying, I will note down. I will give some Deepana Pasana for 3 days. I will take some amount of as a preparation amount or advance. After that, I have to work again for 1 or 2 days. After that, I have to give a medicine. That's how my practice was developed.
Okay, sir. Thank you. Dr. Ani, you can unmute and raise the question.
Hello, sir. Sir, in a case that you mentioned, you have mentioned that it is diagnosed as Swasa. I think it is CA lung that you mentioned. So, in that case, have you ever got a differential diagnosis wherein you thought it might be Rajakshma also? Like we could treat in lines of Rajakshma also. And if in that case, how do you do a differential diagnosis when we have something very close?
Yes, madam. The Rajashma and Swasas are somewhat near. When we go for the Lakshana, it was somewhat similar. When I took a history, the problem started with the difficulty of breathing. The breathing problems for initial days, so later they started the diagnosis of Bala was slowly gone off. We can consider it as Rajashma also, but predominantly disease started with the Swasa and converted into Rajashma. That's why I used Hemagarbha Kote, Pranasanta Malini also. We can use. I told Cytoprial the tablet which I used. The disease started with the Swasa, madam. Usually
So
Rajashma, what happens?
decided to be on that line, right, sir?
Madam, Rajashma, what happens? Along with Swasakasa, Jwara is also the Lakshana we'll see. And Balakshaya initially starts. But in this patient, Balakshaya was not there initially. Initially, it was only a respiratory problem. Later, after 1 or 2 years, they started losing the Bala. First, they initially not understood. But in Rajeshma, like Samprapti, initially it is only they'll starting losing their Bala.
Okay, sir. Got it, sir. Thank you, sir.
Thank you.
Thank you, sir. Any more questions? Sir, what is the role of Chincha Panaka in pancreatic CA? Can
Madam,
we advise it in pancreatitis with Ati Drava Mala Pravrutti? Ati Drava Mala Pravrutti.
I think no, madam. Only pancreatitis. There is a Tivra Shula and role of Pitta was more. In this patient, what I told, Aruchi with a Shula. Diagnosis was totally Aruchi. The patient is not willing to take, or not able to take food. Whenever they get a food, they are getting aversion. Even food was not able to swallow. To increase that Ruchi, I given a Chincha Panaka, but that will surely increase the Pitta. So pancreatitis, if there any Pittanubandhi Lakshanas are there, I don't advise. Even you can go for Dadima Swarasa. Instead of Chincha, I advise Dadima in that conditions.
Okay. Dr. Ashwini? Dr. Shakuntala ma'am, you can ask.
Yeah, ma'am. Sir, whatever you have said, no, pancreatic cancer, in that you have used mustajala and other things. It's a very simple line of treatment, but wonderful results you got, sir. And have you any cases regarding pancreatic CA? Other cases of pancreatic CA is one question, sir. Another
No,
question.
madam.
Sir.
I don't have another cases related to pancreatic CA. Pancreatitis patient was seen. The pure stula was there. And that time I given Vishagarbha Taila Matra Basti for 8 days to reduce the pain. Along with that, again Shulara Chikitsa was done, but it was not a CA. Only pancreatitis was there.
Sir, in that case only you have used Vidanga, no, sir? Vidanga is Ushna Tikshna, Dadimadi Rasa along with Vidanga, no, sir? That is
yes, madam.
Yes, sir. So how it acts like a pancreatic CA? Vidanga is of Ushna and Tikshna, no, sir?
Vidanga is Tikshna, madam. The reference is from Vaishyajaratnavali. Dadima Swarasa with Vidanga Churna is explained in Asadhya Aruchi, madam. Dusadhya Aruchi was there as a reference.
Okay,
so
sir.
I thought we can, and another thing was when total loss of food was there, means sure thought there is any avarodha was there. We have to consider to remove that avarodha. I used Vidanga, madam. That combination I selected. Again, in that patient I selected Katuti also for Tikshna Shodhanartha. I thought there is no patient is not willing to take food, means that much ama was there, rather that much avarodha was there was my thought.
Thank you, sir. So in all the cases you used Mustajala. Most of our Vaidyas are using Shadanga Paniya, sir. So how have you tried Shadanga Paniya and Mustajala, like Musta in one case and comparative you have done, sir?
No, madam, I not made comparative with that. Usually what I Shadanga Paniya I prefer in clay the avastha, madam. When I feel clay the yukta agni mande, that time I will use Shadanga Paniya. But all the CA I not used Shadanga Paniya. Plain Mustajala I used either when I feel kapha was there, kapha predominant was there, I used Panchakola Jala. Instead of Musta, I went for Panchakola. When I feel predominantly kapha was there, there is no role of pitta and all. Any daha like symptoms are not there.
This is for Tikta Pachana you are using, no, sir?
Hi, madam. Tikta Pachana, I told no, Vata and Pitta are major role.
Major
and Kapha was Vikruta will accumulating in the Sharira. The cell division and spreading was done by Vata and Pitta. The Lakshana is seeming in the Madarupa Kapha. By considering that concept, I would Tikta Pachana, madam.
Excellent, sir. And in the case, fifth case, you told Tikka, no, sir? So you
Yes,
told for Vatana Lomana, sir, in fifth case. So it is very simple type of approach. But Hikka, because as we know that it is going to harm the patient immediately, like Maruta and this thing, no, sir? One reference is there.
Yes, madam, it's sure.
It is wonderful that you have maintained till that time, and you used mustajala and other things, and consider it as a eranda. How long you have continued this eranda taila basti, sir?
Madam, what is there that patient is not willing for anything. They only relative want and patient only want to sleep at the night. I given 8 days. Along with that, I given some medicines. What I mentioned, Bilwadi Siddha Peya, Hemagarba Potali, Nagaradi Churana I given, they it given back to me. They didn't consume it. After eight days, I given Basti. They felt happy for 1.5 months. Again, after 1.5 months, it was started. They came again. I given for 8 days Basti. It was happy. After 6 months, 6 months, the patient was died. They completely sudden collapse was there. I feel somewhat we can consider it as like a paralytic approach. The patient was not willing, not able to move his hand and legs. Like that, the patient was live for 2 days. That time also I tried with Bharatwar Chintamani to regain, but it was not happened, madam.
Sir, the Bilwadi Siddha Paya, sir, I think Paya. So, Bangasenka reference you have told. So, it is totally different concept we are listening. Will you share that yoga in the group, sir?
Madam, after that I will share, madam. I not have presently Vangasena with me. I will
Yes,
take
sir.
a picture of that and I will share. The same thing was there in Bharat Bhaishya Ratnavali also. Bharata Bhaishya Ratnavali also it was there.
Okay, sir. Thank you so much, sir. And one more question, like Ashwagandhadi Leha, you or most of the in protocols you are used Leha or Rasayana therapies.
Yes,
So
madam.
what usually we thought initially we should not use any Rasayana Leha because it is not going to absorb. So how we have planned? Have you planned initially Deepana Pachana and after that you have incorporated this Rasayana, or initially you have started because you got
Initially,
result?
initially I started, madam, because what I did, Musta Jalapana was there for a regular Deepana Pachana, and Ashwagandhadi Leha, which was there, that will also make the Deepana Pachana, madam. So, and directly we can use Ashwagandhadi Leha. Another Rasayana which I told is Brahma Rasayana, that is having, that is a reference from Charaka Samhita.
Yes, sir.
That is there from both Rasayana property was there also there and Shodhana property is also there, madam. So Satya Rasayana we can directly use. Again, Agastya Ritik Rasayana and Vashishta Rasayana I told in the Shwasa patient. That is also Ushna Tikshna in nature. We can start directly as I started for Agni Pachana, Mustajala or Panchakula was there.
Yes, sir. And Shilajitu, you are doing your own Shodhana, sir? You are buying from some other, sir? Shodhana and
Shilajitu, sometime I'm doing own Shodhana, madam. When it is not possible, I'm using Patanjali Shilajitu. Patanjali, we are getting directly Shodhita Shilajitu, madam. That was semi-solid form and Shodhita form only. Usually what we will get in a Shilajitu in the market, that is with the Tripala Bhavana or Amalaki Bhavana, powder form we will get. Only Patanjali pharmacy, I got it as in a liquid form as it is Shodhita. Whenever it is not possible by me, I will take it from the Patanjali pharmacy.
And thank you so much, sir. It is a really wonderful presentation with simple approaches and simple medicines.
Thank you.
I'm complete. Please go ahead.
Thank you, sir. Dr. Ashwini wanted to ask some. Dr. Ashwini. Okay, sir, in the chat box, some questions are there.
Okay.
Sir, what about Rakta Dushti? Shall we do Rakta Mokshan?
As a Sthanika, any growth was there, madam, we can do the Rakta Mokshana. Like a tumor was present over that, or it was visible over the body like that, chest wall. In breast CA, we are planning, but still I'm not did. Other growth was there, we can do surely Rakta Mokshana. But what happens, madam, in Rakta Mokshana, I feel use a Jaloka was the only choice. Don't prick it. After pricking the growth, formation of the growth will increase. Yeah, if anyone may notice it or not, I don't know. After going for FNAC, the size of the tumor is going to increase. So I don't advise to prick. Simply directly by using Jaloka, you can go for the Rakta Mokshana. If you prick it, there is a chance of rapid growth.
Okay, sir. Thank you, sir. Please explain Tikta Pachana.
Madam, what we are saying, Tikta Pachaka is mostly helpful in Pitta condition. Whatever we are considering CA, there is a sure role of Pitta because the continuous Pachana of the cell was going on. how much pachana has to occur and form a cell that is not occurring. So the whatever Agni was there, that is a Pitta Pradhana Agni in Sthanika's place, whichever dhatu it was there. So I used Musta as a Pitta Pachaka. Either we can go for Gudichi, Patola, Vasa.
Sir, your voice is breaking, sir. Please.
Sorry, madam.
Can you
As I
repeat?
told, yes, madam, I will repeat. As I told, there is a role of pitta, which is going for continuous pachana of the cells, which the cell has to make properly. It is beyond the level. So, at the whichever dhatu it was occurring, in that dhatu, the dushta pitta janya agni was working. So, control that pitta sadita pachana dravyas we are using. Regularly, as Musta, either we will go for the Gudichi Jala also we can use. Gudichi also act as Tikta Pachaka and Rasayana property was there. I feel Patola and Katuki along with Gudichi we are using. Sometime when there is lot of Rakta Dushti was there, along with that we will add a Musta. Vasa. Musta was there regular choice. We will add additionally Vasa for the Rakta Shamaka.
Okay.
After Musta, I feel Gudichi was the best choice.
Thank you,
Because
sir.
it is having Rasayana.
Sir, here is a case of gallbladder CA. What
Okay, ma'am.
treatment is recommended by you? Can we know it? Bile is more than 10. Jaundice is there. Agni is Manda.
Agni is Manda. Again, I feel if you Katuki with the Shodhana Chikitsa, gallbladder says somewhat the Lakshanas are nearer to the Shula, madam. Sthanika Shula or Pitta Shula. So you make any Pitta Pachaka Dravyas again. Katuki was the best choice. Gudichi. Along with that, you can go with the Kaddali Siddha Grutam. That act as good in that. Or Kamala enough treatment we can follow. You simply using Kaddali Kanda mixing with the Gruta, we can give in that condition. That will also help. Katuki was the best choice. Draksha. After that, when we feel there is little reduction of the pain and all, we can go with the Drakshadi Gruta. Plain Draksha Kshira Gruta Sadhana we can do it. We can use that. Now, line of treatment of I prefer for Kamala line of treatment.
Okay, sir. Thank you. Sir, for Brahma Rasayana, any pharmacy reference, sir?
Cortical pharmacy it was available.
Okay, thank you. Sir, you say apply Jaloka, but where to apply? Either on affected site or near to affected site.
Affected site only, madam.
Okay, sir. Thank you. Any more questions?
I think we can move ahead.
Okay, sir. We can continue the next thing, sir. Slides, you can continue, sir.
Okay. Maybe that is not there in the slide form. That is in the word form. Just I will
Okay, sir. Whatever it
go
is,
with the
you
okay.
can continue, sir.
Okay, thank you. As I told, the another part of my presentation was usage of tripala in many other different conditions with a little changes along with the tripala, one or two additional drugs. Why I wanted to say this was because many times what happens, we start following the combination of the medicines. We feel this drug was not available, we'll do. The condition was not favoring us. So with the easy formations, how much disease we can control by considering that part. And to make this part, when I started my initial practice, financially I'm not able to purchase many medicines. Tripala I have easily purchased 3 to 4 kgs. By using tripala and many other combinations, I started my practice. Shall I start with the yogas?
Sir,
Yes, sir.
actually, it is not completely visible.
Sir, you
Can you make it
enlarge
What?
it, sir.
Enlarge,
Full
madam.
screen,
Okay.
you can make it, sir.
yes,
Okay.
yeah, please, sir. Thank you.
Okay. The first combination is explained in Mutra Purcha Chikitsa. Tripala, Kalka, Kola, and Lavana was a combination.
Sir,
As
it's not full screen, sir.
Now it is, madam.
It's a vertical, sir. You can.
It is vertical, madam. There are 46 yogas are there, so all are in vertical form. Shall I change it to?
Slide. No, you
Okay,
can. Okay. Sir.
Wait, madam. I'll try to change it. Now it is okay, madam. Or shall I change it?
You have
Yes,
to
sir.
change
Yes, sir.
better
The
than
first one.
before.
Okay, madam. Tripala Mutra Karcha, where difficulty for urination. For that condition, the avarodha was there. Pain was there by the vata and kapha. So the combination we can use is Tripala Kalka, Kola Churana and Lavana. Lavana is removing the clay which is making avarodha and gati for the vata. So Tripala is again Anulomaka. For that, simply in all the type of Mutra Kurcha we can use Tripala Kalka, Kola and Lavana Churana. Again, Tripala Kashaya for Davana and Netra Roga, I think everyone know. Kavala and Mukha Roga, Pana and Kamala. In Kamala, are the regular usage of plain Triphala Kashaya will give a result. Triphala Kashaya, early morning we are giving around 100 to 150 ml. Whole day they have to stay on the rice and ghee or only on the milk. That within a 5-6 days, Kamala is going to reduce. All the symptoms of Kamalas are going to reduce. As I told, Mukha Roga, I given in a CA patient for 5 times Kavala and Gandu Chavin with the Triphala Kashaya. The preparation of Triphala Kashaya, which is told that is little bit different. There are different varieties are there. While explaining combination of Triphala, 3 part of Haritaki, 6 part of Ibitaki, 12 part of Amalaki. That combination we have to follow. That is useful in above condition. Again, in Visarpa and Jwara, Virechanartha, we can use Tripala Kvata, Nishota and Sarpi. Nishota is Trivrut. In Visarpa, there is a lot of Pitta was there. We have to expel the Pitta from the Sharira so that we can, along with the already Tripala is Anulomaka, to increase the potency, we are adding Trivrut, Sarpi to reduce the Pitta. We can use this combination. Tripala Kvata, Madhu and Grita, ST in Sarva Timira Roga. Triphala Kvata, we are making, along with that, we are adding Madhu and Grita with the ST Madhu. Timira, at the bedtime, we have to advise before sleeping. We can take the medicine and sleep. It will give a wonderful result. Even it will reduce the spec number up to 3.54 after consumption of 1 month. Before that, we can plan for Tarpana also. Triphala Kvata and Guda in Vishama Jwara. Triphala Kvata and Guda in Vishama Jwara. Vishama Jwara, what exactly? Jwara is reducing and coming. The little ama was there in the Sharira. To expel that Sharira from the Sharira, Triphala Kvata with Guda we can use. Same Katuki can be used. Triphala Kashaya and Bringaraja Surasen Upadamshas Purna Prakshalana. For Prakshalanartha, just washing, we can use Triphala Kashaya and Bringaraja Surasa. Regularly, many are using Triphala Kashaya. By adding Bringaraja, we can reduce the intensity of the Pitta and we can increase the reduce the Rakta dosha. Pitta Kapha Jwara, Triphala, Usira, Patola and Madhu. With the ST Madhu Kashaya, we can use Pitta Kapha Jwara where Daha was also there and a little heaviness was there. To Virechanartha, we are using Triphala. Other Ushira and Patolas are helping to reduce the Pitta condition. Shall I continue?
Yes, sir.
Triphala, Ashwagandha, Draksha, Madhu Yukta means Triphala, Ashwagandha and Draksha. Along with the honey, we can use in Vataja Prameha where Bala was reducing, Sharira Kleda was more. In such a condition, we can use this as a Kledahara and Balavardhaka. In Shota, Triphala Kvata, along with Triphala Shurna and Avakshara, we can use any Stanika Shota or Sarvanga Shota, we can use Triphala. By adding Triphala Churna, the virya of the drug was increasing. By using avakshara, we are trying to remove the avarodha, which were they responsible for shota. This we can use in all the type of shota, baya and abhyantara shota. Even it can use it in shula, shula in Udara Pradesh. Trifla Kwata, Gugulu, in Kleda Paka Yukta Srava. Usually again in a different runa, Dusta runa, for washing, we can use Trifla with the Gugulu, that will give a different level of result. Simply by using washing with the Trifla, it will give a good result. But when we add a Gugulu, whatever Durgandha and Kleda was there, that will reduce. And by adding with the Gugulu, the Rukshatva again starts. The Ropana is also begins faster than the only using of plain Trifala. Trifala, Kwata with Mahisha Sarpi, Shota Pramehan, Nadiruna, Bagandara. Here the Paka was more. To reduce that Paka, Mahisha Sarpi was told it is Guru in nature comparing with the Go Sarpi. By that we can reduce the Kledatva in that part. Trifala, Katuki, Patola, we can use it in Jwara, Chardi and Amla Pitta. In Amla Pitta, this combination will give immediate result. Within half an hour, we can get a good result by considering that what happens when the Amla Pitta was their severe condition. By giving Trifala with Katuki and Patola, immediately the motion will occur within 15 to 20 minutes. The patient will get complete relief. Trifala, Devadaru, Daru Haridra, along with the honey, we can use in Prameha. Again, this is where Atyanta Kleda Yukta Prameha, patient is feeling that heaviness, total heaviness, lot of sleep. In such a condition, we are using Trifala, Prata, Mrudvika, Mukha Paka. Mrudvika is Draksha, where predominantly Pitta was there. We want to reduce the Pitta. Along with it, we want to make Runa Ropana. In such a condition, along with the Tikta Dravyas, we can use a Tikta Madura Dravyas, Trifala can be used. Trifala and Panchatikta Kwata used in Kamala and Pandu. Kamala and Pandu, usually what is Avarodha Janya Samprapti was there. Rasava Srotas is avering. Rasava Srotas is affecting. We want to make Shodhan and Anulomana. For that, we are using that Panchatikta Kwata along with Trifala we can use. Trifala, Ashwagandha Paka. Ashwagandha Paka we have to make. In that Sharkara and Madhu. In Rakta Pitta, Daha Pitta Shula we can use. Plain Trifala with Sharkara is also act as Tambaka. Sharkara, Ashwagandha we can use at for the Balavardhana. Pitta Shula we can Ashwagandha along with Trifala is helping. Bahumutrata was a condition where explained by Shajaratnavali, excessive urination was there. Trifala, Venupatra and Methi was there and not simply instead of plain Trifala I tried in Bahumutrata. It will give a Bahumutrata, Trifala along with banana we can give, that will reduce the Bahumutrata condition. Trifala Kwata along with the Sarpi made and kept in a Loha Patra for a whole night. It has reduced the Timira. Again, we can say blindness, where we want to reduce the number of the specs or remove a spec. In that condition, we can use the duration of stored for 1 month. It will surely improve the vision. Plain Trifala we are making and keeping in Loha Patra, we are increasing the content of Loha. We are accepting content of Loha from the Patra. Either we can, if it is not possible, in Tripala Kwata, we can add a pinch of Loha Basma and we can give. Trifala Kwata, Guduchi, Daru Haridra, Nimba is given for Shita and Madhuyukta Kamala. Sita, given with the Sita, that is Sharkara and Gruta, honey in Kamala condition. Again, I told plain Trifala is also helpful. Either we can go for plain Guduchi is also helpful. We feel there is more dosha was there. Trifala and Guduchi, Daru Haridra, Nimba was used with the Sharkara and honey. Trifala Kwata plus Rasa Sindura in Mutragata. This Triphala with Rasa Sindhura we can use in even renal failure condition. Either we can go with the Triphala Kata or Vasa Kata. If Vasa Kata reference was there from Vangasena. For that also Triphala with Rasa Sindhura or Vasa Kata with Rasa Sindhura, it will help to reduce the serum creatine level. Triphala Daru Haridra Musta Abrakain Prameha. Again, wherever we feel Kleda Yukta or Kapha Pradana Kapha Medojanya Vadi, we can use this condition. Triphala Daru Haridra Musta Abraka used in type 1 diabetics to reduce the insulin dosage. It will give a best result. We can add even Nagabasma to it. Triphala Kadira Nimba, it is best in Kutta. Yes, madam. Hello? Hello? Hello?
Please continue, sir.
Continue. Okay.
Sorry, sir, you can continue, sir.
Okay. Triphala Gugulu Pippali in Shita Pitta, where Shita Pitta and Vata predominantly was there, we can use this combination. Plain Pippali, we feel there is no predominant of Pitta, a lot of Pitta, only Vata and little Pitta was there. Instead of Triphala and Gugulu, plain Pippali with Sharkara can be used. Triphala Kata with Kanchanara and Galaganda, that was all of, I think everyone know about the Kanchanara property directly indicated in Galaganda. Many are using Kanchanara Gugulu in any type of growth. Triphala Churna with Mudga and Galaganda, that is also helpful. Lagu Pachana and Shroto Shodhana action was there. Triphala Katuki and Madhu in Urustamba. Here we want to remove the Avarodha by Kapha Medas. So to increase the Mala Pravrutti along with Triphala, Katuki was added and Madhu was to use to reduce the Kapha Medohara property. Triphala, Chavya, Katuki, Pippali, Madhu, again it is used in Urustamba, the same. Along with that, we are adding Deepana Pachana as a Ushnadravya, Chavya and Pippali. Triphala, Churna and Loha Vasman, Sarvashula, whatever, irrespective of condition, the patient complains of stomach pain. We can give Triphala and Loha Basma. Either you can give directly Triphala Loha Basma, Triphala Loha Basma with Madhu, or Triphala Loha Basma with Grita. It will give an immediate relief within a 10 to 15 minutes. Most of the patient will get relief. I can't say it is 100% all the patient will get a relief in 10 minutes, but most of the patient I got relief within a 10 minutes. Severe pain, severe abdominal pains. Triphala Churna, Haridra and Madhu in again Prameha, it acts as Kledahara. Triphala Churna, Pippali, Madhu, Sarpin, Jwara, Kasa, Shwasa. This we can use in a COVID condition also, or swine flu, where Shwasa Kasa with Jwara was there. In such a condition we can use Triphala Nagara plus Shilajitin, Murcha Roga. Some patient will say continuously they will feel a giddiness. Suddenly they will fall, like that patient we are getting, or we'll call giddiness along with a tinnitus. Such a condition, Triphala with Nagara, plain we can use. Either if we feel we want to make some Karshana, we can add a Shilajitu. Instead of Triphala, Haritaki and Nagara can be used in Murcha Roga. Triphala and Dugdha in Chaturtha Kajara, again we want to maintain the Bala and Virechana. For that we can use Triphala. Triphala Madhu Sarpi Netra Roga. Triphala Madhu Sarpi along with ST, one combination is also there in Ashtanga Hridaya as the Anupana of Amalaki Swarasa and Netra Roga. Triphala Gruta Madhu Sar. Triphala Gruta Madhu ST Madhu with Amalaki Swarasa was also there. Triphala plain Triphala with Gutika, Triphala Gugulu, with Takra we can use in Arsha. Plain Triphala Churna along with Takra is also help in Arsha. Within 3-4 days, the patient will get a relief from the pain, but growth was there. Triphala plus Kanji and Gulma, whatever the Abhyantara, Shota or Abhyantara Gota, PCOD condition also we can use this combination Triphala and Kanji. Triphala with Ushna Jala, Mutra Kurcha, again I told Avarodha boy there, Vata and Kapha to remove that. Triphala and Taila and Rudroga. Rudroga here we are giving concentration towards the, as per the classical Rudroga, where patient is feeling a lot of heaviness over the chest or different types of pain, pricking type of pain. In this condition, Tilataila with Triphala we can use. Hindu Kantarasa has along with Triphala is Jwara. Triphala with Matulunga Rasa in Shula. As I previously told, Triphala with Loha Basma are either only plain Matulunga Rasa with salt is also gives the best relief in pain. It may be even it can be used in cardiac pain also. Triphala, Kanji, Yava, Punarnava, Lepain, Vrushana Ruddhi, where at increase of penis size in such a condition we can use Triphala, Kanji, Yava, and Punarnava. Punarnava is having the capacity to regrow the cell. Whatever cells are dead, it is help to generate the cell. In such a condition, we can use Punarnava along with the Triphala. Triphala plus Shoma Basma Lepain, Agni Dagdaruna, where burnt injuries are there. Silk, we have to burn the silk and mix with the Triphala. We can go for application. It will heal. Agni Dagdaruna, plain Triphala oil is also used. Triphala oil with the coconut oil also used. Triphala Kwata with Gomutra, Madhu Sharkara for Lekana. Whatever Kapha Medojanya Vyadhi was there, we can use Triphala, Gomutra, Madhu and little Kshara in it. And this combination can be given in the form of Basti also in Stowl and other Kapha Medojanya Vyadhis. Shall I continue, madam, or it is fast?
Sir, what is that Shuma Basma?
Silk, madam. Silk we have to burn and make. Silk, madam.
Silk.
Reshmi.
Okay. Continues.
Okay, madam. Triphala, Kwata plus Gudichi, Nimba, and Musta for Virecha and Kaphaja Vyadhi, which all the Vyadhi may be anything. Where Kapha and Medo Pradhanata was there, we can use Triphala, Kwata with Gudichi and Nimba. Mutra, we are using Gomutra for Virechanartha. Triphala, 3-part. Triphala plus 3-part of Sarpi for Virechanin. Tridoshaja Vyadhi as Vayastapana, where we want to make increase the bala in the form of rasayana and all, and we also want virechana in this condition. We can use Triphala with Gruta, as I told Brahma Rasana. Instead of this, we can use this combination. Here both Shodhan is also occurring and bala will also increase. Triphala plus Kshira and Pittaja Ashmari Shula. When Ashmari patients comes with a lot of pain as an emergency, we can use this condition. Plain Triphala Kashaya we can use, or either Triphala Churna with Loha Basma is also helpful in this condition. Triphala, Loha Basma, Lepa and Shvitra and Sidma Kusta. Triphala Churna we are taking Loha Basma application over the wherever Shvitravitis patches are there. Instead of Loha Basma, Tamra Basma reference is also there from Basavarajiam. Instead of Triphala, we can go with the Arkakshira with Tamra Basma in Shvitra. That will also give a good result. Triphala Gruta, we have to make Sneha Pak in Abhishanda. All the Nitra Roga we are using Triphala Gruta. I think I do not to explain this more. This is a special reference where Primija Granthi, when any ulcer or any tumor like formation is there, in that krimis are present. To remove that krimi, Triphala, Kasis and Tutta we can use as a Pratisarana. By application, we can remove those things. Triphala Kwata, again Triphala Kalka Gruta, Sarva Drushti Rogahara. Again, here we can use the potency by adding Shira as a Dravadravya. The Triphala Gruta will become more potent. All the retinal disorder or whatever the disease of related to Netra, even the patient lost his vision, it will help in such a condition. Again, same Triphala with Swarna Makshika was there from Ashtanga Hridaya. That is also helping Sarva Netra Rogara. Triphala, Nilini Patra, Loha Basma, and Drangaraja Bhavanin, Avimutra, and Shweta Kesha. The children say bedwetting conditions, we can use Triphala and Nilini Patra, Loha Basma, and Drangaraja. We have to make Bhavana by Drangaraja Swarasa. Shweta Kesha means whitish hair. The same preparation we are preparing the Taila giving for the application. Triphala plus Nagara Churna Takra. We are using in Amavata. Instead of Triphala, we can use Gokchura with Nagara in along with Takra in Amavata. These are some easiest preparation in different conditions with only tripla and few more drugs.
Sir, in obesity, you didn't tell the any combinations, sir.
Madam, the obesity I told no sarva kapha medohara as tripla.
That only they can use.
Ha,
Okay.
madam.
Alama, madam,
Tripla,
your problem is solved, I think.
tripla
You
kwata
got the
gomutra
answer.
madhu and char. Tripla kwata gomutra madhu and chara. We are giving, madam, as a panartha we can give, either we can give a basti, lekana form of basti.
Okay, sir. In vata conditions also we can use, sir, this gomutra and all.
What I didn't hear, madam, properly. Sound was not clear.
Sorry.
I not heard, madam. Sound was breaking.
Tripala kata, gomutra and madhu shara you advised in lekana, right?
Yes, madam.
It won't aggravate vata, this means disorders.
No,
Like
madam, we are
it will.
giving. No, madam,
Yes.
it will not aggravate. What happens if the patient was more sensitive? If we give the Bastin more than 400 ml, that time the
Okay.
patient will feel somewhat giddiness and all, but that is also for temporary reason. After Tikshna, Svedana, if they are given, if the Svedana is normal and the Basti was there, nothing will happen, madam. Vata is not going to increase. Because we are advising in a condition where Kapha and Medas was more.
Okay, sir. Okay, sir. Thank you, sir.
Okay.
Few questions are there, sir. Shall I take?
Okay. Yes, madam.
Sir, what is the proportion of dravyas in churna combination in mutra krucha?
Madam, that is equal combination, madam. There is no special combination was mentioned. Trifla, Kalka, Kola and Lavana. All are equal quantity.
Role of pata in mukapaka.
Mukapaka pata is reducing the pitta, madam. Pitta is main responsible for the paka action of pitta.
How to interpret Urustamba and Chaturtaka Jwara in nowadays?
That was a Urustamba will get a very rarely, madam. Only one patient of Urustamba I've seen in my experience from beginning of BMS. The patient say, I'm not able to walk. The leg was so heavy and even not able to put. It was like a just if Chaturthaka Jwara, what occurs, madam? Nowadays, patients are more conscious. If little fever is coming, they are going for the paracetamol and all. Differentiating the Jwara in present day is so difficult because patient not come to us directly and they will not live up to getting the symptoms. Regularly, they are taking paracetamol, antibiotics and all. So, interpretation is become difficult in present day. Because what happens, madam, soon after getting little symptoms, before coming to the clinic, they will take a paracetamol.
Right.
Either they will go with the
Yoga for
antibiotic.
bedwetting. Yes, sir.
What, madam?
Right, you are right. Yoga for bedwetting in children, sir.
Yes, madam. Plain basically we can also use it also give a better result. Vimutra Tripala, Nilini Patra Sarasa Loa was Bringaraja Bhavan was there, madam. Only once I tried this. After that, plain Harithika I am using, madam. That is also giving the good result.
Yes. Thank you, sir.
Okay.
Sir, some people says don't use Tripala Churna for long time because it aggravates Vata due to Rukshata. Is it true?
Yes, madam. Sure shot. Last reading the Kafaja Udara condition, I explained why I not diagnosed as allopathical management. When we use Triphala for longer duration as a Virachanartha, Triphala is Atyanta Rukshaka. When it is not necessarily, we will use sure shot, it will increase the Vata. And there is no doubt Rukshata will occur. Whenever it is needed or directly indicated that condition we can use. How much time we want, that much time we can use. But there is a condition is not suitable where role of kapha was not there and we don't want to, the condition is not suitable for Rukshana. In such condition, if you use a triphala means vata will surely aggravate and patient turn to worsen condition. The symptoms are going to increase.
Okay, sir.
That's why don't advise triphala for constipation. Regular usage of triphala for constipation, it is increase the pakvashayagata vata. So to go for many different samprapti.
I think Mugda's question is incomplete. Which kshara, sir? Here.
Yavakshara, madam. Wherever plain we are getting kshara, we are taking yavakshara. Whenever yavakshara was not available, other kshara we can use as an emergency. But kshara, plain yavakshara was recommended.
Okay. Dr. Swati is asking what is the Nilini Patra?
Nilini was a drug was there, madam. It is a virechaka. Blue color flowers are there. It is not regularly available. Even market also, the powder form also we are not getting, madam, that drug.
Okay, sir.
That was a virechaka drug was. The drug having the main property of virechana.
Right, sir. Dr. Alama ma'am asking, sir, any successful lepa in Venga?
Successful lepa in Venga, madam, again, what is Masura Dala. Masura Dala with Grita Bharjana, we have to make. After that, we will make a powder and give for application. That will give a good result, madam. After that, we will give advice for Kunkumadi Taila Abhyanga or Kimshukadi Taila Abhyanga, that is Palasha Pushpa Taila.
Okay. What can be given in gallbladder calculi?
Gallbladder calculi, what I told ma'am, that again the same line I advise. Katuki was a must and should choice of mine. After that, we are using Patolar, Draksha Sadhita Grita, Kadali Kanda Sadhita Grita. I'm trying, madam. What happens in renal calculi, gallbladder calculi? Patient comes with a symptom and report. Whatever will give a medicine, they will take. Symptoms are reducing. They will not go for another line of investigation for confirmation whether it is reduced or not. So, but symptoms are going to reduce sure shot by Sabja Virechana by Katuki and Grita with Patola or Draksha Sadhita.
Okay, sir. Sir, in Fitra, Tamrabhasma and what to add?
Tamrabhasma with Triphala or Tamrabhasma with Arkadugdam. For external
What
application.
can be given in Urustamba, sir? What would be the diet while taking Triphala as it increases Vata?
I told no, madam, Kshira as Anupana we can give or Eranda Taila as Anupana we can.
Dosage of Aritaki in children for 4 years for bedwetting. Anupana, how long can be given?
1 spoon, madam, at the evening time with hot water.
How long can be given?
You can give 1 or 2 months, madam, until the symptoms are going to reduce.
Okay, sir.
Ask the patient, madam, in children what happens? Any manasika stress was there, that is not going to reduce. Because what happens in school and other things are in a family, they have a fear. If that lot of fear was there, the symptoms are not reduced easily.
Yes.
One patient I have, whichever day he goes to school, they make a bed wetting. If he not go, means he was normal. That Lakshana was not there. In such a condition, we have to advise Medyagrita and Santwana for that patients.
Okay, sir. Sir, how do you decide the dose of each drug in the combination, or is it Samapramana?
Wherever I felt different dosage was there, I mentioned those things. Where I not mentioned, those are Samapramana. Whenever I mentioned Kshara and Basma, I will use less quantity than the Churna and other things. Other dravyas I am using equal. Kshara and Basma I am using less, half or 1/4 of the other Churna dravyas. If any other dravyas are there, I will use equally. Wherever it is called ratio of code, I will use in that ratio only.
Sir, Ati Udgara Pravrutti is under Amashayagata Vata or Pakvashayavata Gata?
Usually Pakvashayagata Vata it will see, madam. Amashayagata Vata Udgara was less. Especially what we are saying, Prana and Udana Vata Dushti was there, begins from Pakvashaya, madam. I feel it is begins from Pakvashaya. So, as per the patient, if there is no any role, Amashaya may be, but I feel Udana Vata Dushti, Pakvashaya was the origin.
Sir, any alternate to Nilini Patra?
I used Kampilaka, madam.
Kampilaka.
Kampilaka and half of the other dosage. But I stopped using that to yoga, madam. Simply I'm using Haritaki. For that I stopped.
Okay. What about when Tripala was mixed with Grita and Madhu with respect to Rukshata?
Nothing will happen, madam, because Grita was there, Rukshata is not going to increase.
What is the dosage of Rasa Sindura and Tripala in Mutragata?
Usually I practice one pinch, madam. In Kashaya, we will prepare our 1 spoon of Tripala Churna. In that 1 pinch of Rasa Sindura will add. Otherwise, as a quantity of bulk making, I think Rasashastra people know very well. Total dosage, how much dosage was there, we will calculate for the month, and that much of Churna and Rasa Sindura will mix. If you are adding in a quarter, I will advise only 1 pinch.
1 pinch only, sir. 1 to 2 rati is sufficient, sir.
Madam, that's what I told. As a bulk making quantity, we'll calculate how much dravya we are using, that much we are adding. If it is kwata, only 1 pinch I will use. 1 or maximum 2 pinch.
Okay. Sir, how to use Nilini Churna for hair dyeing?
I told no, madam, I didn't got that drug. Only once someone given me Nilini Churna in the powder form, I used it. After that, I don't got that drug. I not used it. Even many other Udara Kalpana also, I think Nilini will come. In that condition, I use either Katuki or Kampilaka instead of that.
Okay. Role of Kadali Kanda in gallbladder stone you gave to patient.
Yes, madam. Kadali Kandu, Grita we given as a Kshara, the whatever Pitta was there, it is in the Gratita form to reduce that by considering the reference of Rakta Pitta Gratita, Rakta in Kanta Pradesha, Kamala Nalakshara was told. No? So by considering that concept, Grita and Kadali, we are used, madam. The Pitta is there, the Pitta which is becoming Gratita and hard in nature. So remove, to make dissolve that, Kshara we are giving along with we are preparing that Grita, madam. Kadali Kanda Grita. I heard from some Vaidya from Maharashtra that combination. I practiced that, madam.
Okay, sir. Sir, how can we use Tripala Churna in steroid resistance nephrotic syndrome?
I told no, madam, I don't want to correlate with anything. Nephrotic syndrome, that whatever the Mutragata, Mutrakurcha Lakshana you are getting, in that condition, Tripala with Rasa Sindara we can use. It depends on the Lakshana, madam, how the Lakshanas are there. If it is Vata Pradana, we can use Tripala with Grita. If it is Pitta Pradana, we can use Tripala with.
Okay, sir. Thank you, sir. Please suggest combination of Tamra Basma and Tripala Pramana for white hair, gray hair.
Gray hair, usually we are giving in the application, madam. What I will not use a Tamra Basma. We add a Loha Kitta, which is rusted iron, with Tripala and make a Taila, madam. By adding that dravya, we'll make Taila Paka, we'll give for application.
Okay, sir. Okay, I think done, sir. Everything. All questions are done. Really, it was wonderful presentation, sir.
Thank you, madam.
Thank you very much. All simple formulation and I think every easily available combinations.
It's an excellent presentation, sir.
Yes,
Because I can see the Mahasamudra of knowledge in you, and it's very simple approach. You are treating so much critical cases, and the way of approach is also just beyond the what we think actually. So very nice. And I request you to take one more class on tripla different this thing on our regular classes, sir. Because I think complete it is not completely. Because while you are reading, I'm feeling that something is missing. Something is we need to
Yes,
explore
madam,
this.
we can interpret all the yogas with the disease concept. For that, we have to think the disease, which hours of the disease, that is also we have to think. It needed little more time and presentation. I not collected all the explanation for today's class. Just I wanted to say, uh, many are whatever the discussions I've seen lot previous in a group and all are thinking of very big yogas, and the concentration was towards the allopathy diagnosis. So I want to change that approach, how I adapted. For that, I told this was the choices, easiest available choices we can use in different hours of the conditions, where we can give excellent result. And when it comes to the Ayurveda, always people say it was more cost. It is not, madam. Only when we are using Rasoshadi and Swarana and other kalpas, the cost will increase. Either it was a very less cost effective.
One more
Even we
question,
can
sir.
reduce.
You have used so much of tripla yogas now, sir. So have you taken from the reference or some compiled things were there through reference or you have
That's
made
what
it?
I initially told, madam. The what I compilation made was at my internship time.
Okay.
That time I don't have a financial status to purchase all the medicines. And other thing, that time I have 3 kg of tripla with me, and
Oh,
tripla was my favorite drug from beginning. So I thought, what all the condition we can prepare from the tripla, I compiled from all the samhitas, and I started using tripla.
so you have only made all these formulations, sir.
Yes, madam. These all are references from the text, madam.
Next
Nothing was
time,
my own
oh,
formula.
yeah, sir. Oh, super.
Nothing was from my own hand, madam. Only few additionals I
Please
told no.
share the formulations as I was not able to join from before. I may
Yes,
Actually,
share
it
the
is
madam.
link
shared
back.
in the group.
Yes, madam. I wrote one article. I will send that article to group, madam. I will
It's a
share the
very
link over
beautiful approach,
link of
sir.
it.
I hope other upcoming Ayurvedic students think like you and
Yes,
they
sir.
also come up with every single drug and have a good study. It was really very motivating.
Excuse me, do you use triphala with 1:1 combination or 1:2, 1:2:4, like that? In which combination you use triphala, sir?
Tripla 1:1, one only I used, madam. Only I told that the second yoga it was different reference was there. That I used like that only. Apart from that, all the tripla yogas I used 1:1:1. Haritaki, Vitaki,
Seeds.
Amalaki 1:2.
Is
Sir,
it seeds?
Equal
No, madam.
quantity.
Equal quantity, madam. Tripla pala only we are
No,
getting
it
from the
is
market.
with the seeds or without seeds, sir?
Madam, total with seed, madam. We are not separating.
Okay, thank you, sir.
Thank you.
Hello,
can be
Dr.
given in.
Manasa is raising the hand.
Yes, ma'am, I'm asking.
Okay.
Sir, what can be given in Urustamba, sir?
Oh, I told no, madam. As I seen only one case from my beginning of BMS. Uh, Eranda Tegala Shira was given to that patient. That is also not by me, by other doctors. I seen that patient was got relief. After that, I not seen any Urustamba patient. Practical experience. We can use Safamedohara as the tripla. We can use with the Katuke and other drugs. Or Eranda Taylor with Shira was giving good result, madam. That was a reference was there from Udavarta also. That will make the anulomana forth and removes the kapha Medohara action was also seen.
Okay. Sir, how about the Aragvadadi Kashaya and Varunadi Kashaya in case of Urustamba, sir?
Madam, I told no, I have not seen the cases. Varunadi can help
Okay.
in Abhyantara Vidradi, madam. Whatever Kosta Sthana was there, in that all the condition we can use the Varunadi. I don't feel Varunadi can be helped in Urustamba. Aragvada can help because Aragvada is also recommended in Grudrasi condition. So Shakagata, Kafamedo, Aragvada can help. Varunadi, I don't feel, madam, because Varunadi is specially indicated in Kosta Gata doshas. Kafameda in Kosta.
Okay, sir. Thank you so much. Sir, one more thing is, I read recently that Triphala Kalka is made and it has to be kept in the iron pan and
Yes,
it has to be dried under sun. And the powder, if we are taking 5 grams per day for 1 long year, then no other diseases can enter the body, and they can leave what I can say,
100 years, 300
Nitya
years,
Yavana,
700 years,
like
like
that,
that it was
sir.
mentioned. Yes, madam. Like that it was mentioned. Same Gugulu Kalpas are also told in the Vangasena Rasayana Adhikarana, madam. Such a preparations are explained, madam. Those are especially in Vangasena and Rasa Yoga Sagara, if I am not wrong. Vangasena surely short such yogas are told by consumption by 1 year, the person will live 100 year, 300 year without any diseases. Such a
Yes, sir, maybe. Yeah.
Sir, your thought on Sukshma Tripala.
One second,
madam.
Doctor. One second, Dr. Geeta. So please take up the question of Dr. Siddesh, sir. It's very much needed and it's urgent also. Dr. Siddesh, sir.
Yes, yes, I am taking my.
Yeah, please.
In between, someone has raised. That's why. Sir, one Dr. Siddesh is asking, sir, you presented case 1 CA of esophagus. Any treatment for esophageal stricture, sir? Please explain solution.
Esophageal stricture, what happening, madam? The bleeding was there, or bleeding by oral, I think so. The scratches are thin. We can use plain Vasa with the Kshira will help, madam. Vasa Sadita Kshira. Sutta Shekara can be given, madam, there.
Sir, patient is not able to take one spoon of this thing also, sir. Water also. That is the condition. She is on a continuous this thing oral tube, and after when it has taken out, she is not able to engulf one teaspoon of water also. For that, she was on 1 month. She was on IV fluids, and I gave her Sutta Shekara Rasa. Sutta Shekara Rasa initially with the tubes and all those things, but the stricture condition was improving, but stricture was not got, no. So the thing how to apply reduce that stricture.
Yeah, I think Vasa Kshira in with the tube only, madam. Initially, it will Rakta and Pitta involvement was there. So any Vasa with the Kshira will give a result, madam. It will help to recover. And after that, you give a same Gruta, madam. Tiktaka Gruta. Slowly it will start increasing. You try with removing it to 1 spoon of Gruta, or start with the Gruta, madam. Gruta may be not harm to the patient, I think so. If you remove the tube and give a half spoon of Gruta, the patient may tolerate.
Okay, sir. Sir will contact you later.
Okay.
And yes, sir. Thank you, sir. Yeah. And for to join the group, it's in poster. So you can message to us, me or Geeta. You will directly going to add in the group. Thank you.
Anyone wanted to join the group? You can share your numbers here, or else you can go through the poster. In the end, 2 numbers are there. You can join through that numbers. Now, shall we end up, ma'am, with the vote of thanks? Now I request Dr. Veena to say vote of thanks.
Yes, please.
Thank you, ma'am.
One second, Rohit Kumar and Anuradha Chidanand have raised their this thing, and kindly can you go through quickly the questions, because already it is late.
You can post your questions in the group so that we can come back with the answers.
I think, and one more thing, Dr. Geeta, and Koti sir is also with us. Sir, can you come up on the video, sir? Koti sir? Koti Nagarjun sir? Actually, Sudeep sir, Koti sir came for you only.
Thank you so much, madam. I feel my pleasure.
Sir was initially, maybe he was caught off with some this thing. And please, Dr. Geeta, take up the numbers and we can later add into the groups. Yeah, sir. Please go to this.
Sure.
Yeah, go to next, Dr. Geeta.
Sure, ma'am. Now Dr. Veena will question, ma'am. No questions, I think.
I think Dr. Anuradha ma'am and Lohit Kumar has raised their hand. If they have got some questions quickly, they can ask.
May I ask, ma'am? No.
Yeah, ma'am, please. Ma'am.
I just wanted to know how exactly do we prepare musta jala?
Now, musta jala, how we are preparing is from 1 to 2 spoon of musta to 1 liter of water. Just we are boiling up to boiling, bubbles are coming. After that, we are keeping it as water in a flask and all. How much hot we can drink, that much we are advising to take.
Okay, sir. Thank you.
Thank you, ma'am.
Thank you, everyone. Now, Dr. Veena will say vote of thanks. Dr. Veena.
Thank you, ma'am. Good evening, Vaidyas. It was a great session indeed. Thank you, sir. Thank you so much. On behalf of RAAUOS team, I extend my heartfelt vote of thanks to respected speaker, sir, Dr. Sudeep Konkani. Thank you, sir, for accepting our invitation and spared your precious time for the webinar. Thank you so much, sir. Thank you for sharing your cases and boosting the confidence of Vaidyas to take up cancer cases. It was simple approach with simple medicine. Thank you so much. Thank you so much, sir, for enhancing our knowledge in the use of tripala churn for various conditions. It was very simple and very useful. Thank you so much, sir. Next, I would like to thank our beloved founder, ma'am, Dr. Sakuntala Patil, for the platform. Thank you, ma'am. Thank you, Dr. Geeta, ma'am, for smoothly moderating the session. Thank you, Dr. Manjula, ma'am, for invoking the blessings of Lord Dhanvantari. Thank you, Dr. Archana, ma'am, for the brief introduction of our speaker, sir. And I express my heartfelt gratitude to all the delegates attending the webinar who also spared the time from their busy schedule to attend the webinar and making it a grand success. Thank you all. As announced earlier by our founder man, that RAAUOS team is conducting a delicious workshop on Sunday, 7th January 2024. I request all the Vaidyas to join more in number and make it a grand success. Thank you. Thank you, ma'am.
Thank you, Dr. Veena. Thank you once again, sir. It was wonderful presentation. We would like to see you in another session.
Yes,
and
Thank
we
you.
wanted to see you in the regular class also
Thank
for
you.
the discussion and all to enhance our knowledge also. Okay,
Thank
we
you so
would
much,
like
madam,
to
for
see you
giving me
on
the opportunity.
Monday's class. Thank you, sir. Thank you
Thank you so
once
much,
again.
madam, for giving me the opportunity to talk on this occasion. I also tried to share my knowledge as Alpo knowledge which I have. I tried
I
to
don't
justify
think,
the things. Thank you so much, madam, for giving me the opportunity.
I don't think, sir, it is a little knowledge.